With Obamacare costs rising and insurance participation shrinking, the National Center for Policy Analysis has developed a multi-point plan that outlines an affordable and effective alternative. The objective of these proposed changes is to do what the Affordable Care Act has failed to do: create accessible, affordable, and high-quality health care for many more Americans than have it now. Health economist and NCPA Senior Fellow Devon Herrick authored the alternative and explained some key areas that are in dire need of reform.
We can and must replace the Unaffordable Care Act with a plan that is sensible and more flexible. A reform plan should allow Americans to buy the health coverage they prefer and can afford. Reform will be necessary as insurance premiums and co-pays continue to rise under the ACA. We propose healthcare reforms that provide more flexibility in the types of insurance plans for consumers to choose from. Cookie-cutter coverage doesn't work. Patients should not be forced to pay for mandatory benefits they won't use. More doctors, so the supply can meet the demand for care. Create incentives for more medical students and streamline the process for certifying foreign medical graduates. Allow more types of providers like nurse practitioners. More options. Those who lack access to health coverage at work should qualify for a subsidy that pays them as much as the tax savings they would get through employer-provided coverage. More competition on prices. If doctors and hospitals offered transparent prices so patients could comparison shop, costs would go down and quality would improve. Medicaid should be reformed to better serve the needs of low-income families. Medicare should be reformed to reduce the burden on seniors. Better care for the sickest patients. 1/5 of patients account for 80% of medical costs. We can cut those costs and provide better care for the sickest patients by using care coordinators to manage patient care among medical doctors and treatments. Obamacare is unsustainable and will have to be reformed. The sooner this is done, the less painful it will be.
Details on how the NCPA plan will work and be paid for can be found at ncpa.org.